Hello everyone, I'm Dr. Yosra Bastawisy, a fellowship in laser dentistry from Genoa, Italy. I'm very happy today that I'm sharing with you my little experience regarding the usage of diode laser and here from Medlink in Egypt. So I'm going to begin telling you about the dental laser applications. These are the main and basic applications you can use in your dental practice, in your dental clinic. So I'm going to talk about every point from these applications briefly, like decontamination, photobiomodulation, and lesion treatments, hemostasis, surgical applications, like gingivectomy, gingival trophy, phenectomy, operculectomy, depigmentation, lesion removal, and their management, and finally with the laser bleaching. So the main question you ask yourself is why should I get diode laser in my dental clinic for surgeries, for example? So the main advantages of using diode laser during a surgery is the minimal collateral effects results in decreased tissue damage, thereby enhancing healing. Yes, the most important thing we face as dentists in our dental practice is the healing after the procedure. Many years ago, they made many researches regarding the healing process, and they found that there is a lag in the healing comparing the laser treatment versus the conventional technique, for example, in like using scalpel in the surgery. So they found this delay in the healing for 2 weeks using laser devices. But they made more researches, and they invented new equipments, and they found that the delay is for only 24 hours in most of the cases, and maybe this healing is before these 24 hours too. One of the very important advantages is the patient comfort. Yes, we can get the patient to be very comfortable after the surgery because he will not feel any pain, and we are not doing any sutures after the surgery, as the healing is by secondary intention. So we don't do any sutures for the patient, and also we don't. Like in number 3, we can do hemostasis and coagulation for the medically compromised patients, as we know all that the medically compromised patients are not indicated to face any bleeding surgeries. It's not good for them. So we can take the benefit of hemostasis in using the diode laser device. And we are going to discuss it in the upcoming slides too. Most of the procedures can be done with topical anesthesia only. We don't use any injections, anesthesial injections, only in minimal number of cases. And also we can achieve the minimal invasive dentistry. If you are using your dental loops, it will be much better. And as Dr. Amr said, the fibers we are using in the diode laser device is very, very small in size, spot size measurements. So, and finally, the lasers are safe when you adhere to protocol. Yes, if you understand the safety, how to use laser in a safe way, so it's good for you and for your patients. Before going through the applications and begin to explain you the applications in details, I want to agree with you on something, that we as a dentist should put in mind the target of the result we want to get in the dental clinic in this surgery or this application we are doing. For example, we want to decrease the number, decrease the percentage of bacterial infection in our clinic, in our case. So and also if you are doing any surgery, we don't want swelling to happen. We don't want the gingiva to be inflamed, for example. So all of these we can do it using diode laser device. First of all, the decontamination. As we know, most of the lasers have antimicrobial properties such as Nd:YAG and diode laser wavelengths. They are absorbed by bacteria, especially those with pigments, as we know, and Dr. Am said to you all that diode laser chromophore is pigments, melanin, blood. So, and also the laser is very important in periodontal therapy and has significant advantages. But it must be emphasized that laser treatment is an adjunct to the standard therapy. That means that if you are doing scaling, for example, you can do scaling using the laser, as scaling is a hard tissue. The calculus is hard tissue, sorry. So diode laser device is a soft tissue device. So you cannot remove calculus with diode laser, but you can do a decontamination using diode laser after the scaling procedure. Also, the laser, how the laser is decontaminating the pocket is by removing the biofilm within the necrotic tissue of the pocket walls, and it interacts within the inflamed tissue components. If you want to get a better result while doing decontamination, you can use the photodynamic therapy by using methylene blue dye, for example, because the methylene blue dye is blue in color, it's pigmented, so it will get with you using diode laser a better result. Because, as we said before, the chromophore of diode laser is blood, pigments, and melanin. So you can use methylene blue dye, or you can use betadine also, it's red in color. Here, this is a photo I uploaded from the internet. As you can see, this is a photodynamic therapy. The operator is injecting blue dye, methylene blue dye in the sockets, and then he activated his laser. Also here, laser decontamination after surgery, after implant. You want to decrease the percentage and the risk of your patient getting any infection. So by decontamination, by laser for sure, the laser device, you'll get the best results. Okay, photobiomodulation, the low-level laser therapy. It is very, very, very important, and it is the best benefit you can get from a diode laser. You want also to know what is photobiomodulation and how can I use photobiomodulation and what is the concept of photobiomodulation. Photobiomodulation should not be ablative nor thermal, but rather it is a photochemical effect. We are doing a therapy through photobiomodulation. We are not doing any ablation. The concept of photobiomodulation is working as it interacts with the organic molecules. The laser you are using acts with the organic molecules in the mitochondria. The mitochondria is the house of energy in the tissues, and the major chromophores of the cells are mainly localized within this mitochondria. So the specific wavelengths and power absorbed by the complex number 4 of the mitochondria, it is converted to a chemical energy called ATP, and it will increase the oxygen consumption, which will produce metabolic effect, which produce wound healing. And this is the main advantage of photobiomodulation, which is wound healing. As you can see, the company invented a handpiece for photobiomodulation. The concept of this handpiece is that we want a homogeneous amount of laser and homogeneous amount of laser power and density to be absorbed by the target tissue, so we can know the result and expect the result you are getting by this laser. Also, there is another handpiece I can show you here. It's also for the pain therapy. Okay, when should I use the process of photobiomodulation? Photobiomodulation is for accelerating the wound healing. Also, as I said in the previous slide about photobiomodulation, it is a low-level laser therapy. So you are not using high powers. You are using a low-level laser power. So I can use it in wound healing. I can use it to relieve pain the patient is suffering from. Many of the patients come to the clinic complaining of pain, TMJ disorders, and they are feeling pain in this area. So you can treat them while using photobiomodulation handpiece within the laser device. And also, you can use it in some cases for treatment like aphthous ulcer, as the main complaint for the patient in aphthous ulcer is the pain. So you can do it in more than one session treating this aphthous ulcer. So the advantages of photobiomodulation is less post-operative pain, less swelling, accelerates healing, and quicker osteointegration. Regarding the osteointegration, there are still more researches regarding this topic, especially for orthodontists. So what is the side effects of photobiomodulation? It is not a side effect. While you are doing photobiomodulation, you only have two options: that there is a result or there is no results. So if there is no results, so this is a side effect. The contraindications, it's contraindicated to do photobiomodulation in malignant lesions and tumors, because photobiomodulation stimulates the cell growth, and this is not indicated in malignancy. Also, it's not indicated in cases of patients suffering from thyroid gland disorders, and also patients who is having pacemakers. Okay, hemostasis. As we all know, we always face a problem of bleeding while working for the patient. We always want a blood-free environment, so hemostasis is one of the most important applications. What laser do while you are hemostasing the tissue is sealing the capillaries and the lymphatics of the tissue. Hemostasis is not done by coagulation of blood, but by contraction of the vascular wall collagen, which results in constriction of the vessel opening. Okay, so you can combine more than one application, even if you are not doing a surgery while using the laser device. For example, you've done an extraction. After extraction, you can decontaminate the place of the surgery to reduce the risk of infection for the patient. If you are doing any surgery and you want to make the bleeding decrease, you can hemostase this area. So you can combine more than one application using the diode laser while working in your dental clinic. Okay, surgical applications. Before going through the surgical applications, we want to agree on something. Gingivectomy, phenectomy, operculectomy, whatever the application, the surgical application is, the indications of doing this application is the same. If you are using a diode laser or you are using your conventional technique, the way you are used to do with, for example, with scalpel. So it doesn't differentiate. It doesn't make difference while using laser regarding indications of the surgical application. For example, you are going to do a gingivectomy. If the patient doesn't need a gingivectomy, so she doesn't need a gingivectomy. You are going to think if you are going to treat and do this gingivectomy using diode laser or the conventional technique. For sure, you are going to use diode laser. Why? Here, the gingivectomy, let's say first, it's a procedure of removal of gingiva and an indication range from access to aesthetics. The indications: gummy smile, suprabony pockets are present. Access to osteostructure is not necessarily important. Why? Because as we said, and Dr. Ams told you, that diode laser is a soft tissue laser. So we can't remove any bone. We can't do crown lengthening while using diode laser, only gingivectomy. The contraindications, as I said, access to osteostructure, gingival attachment is minimal or absent. White et al., his scientists, compared several laser technologies using histological analysis and determined that wound healing is influenced by certain instruments, settings, power, pulse, duration, and time of exposure. Therefore, wound healing after a flap or gingivectomy procedure using laser therapy depends as much as on device settings or as on the actual laser wavelength used. Also, training is very important, or sometimes more important than laser wavelength. Yes, why? Why he said that? Because, okay, we now agree that the diode laser is perfect, no bleeding, you can hemostase the tissue, wound healing is very good, you're not going to face any problem. So if you are not trained well, you cannot benefit from the laser. If I'm not trained well and there is a case in my clinic suffering from a fibroma, for example. Fibroma is very white. There is no much of blood and hemoglobin pigments, for example. There is no such things in the tissue I'm facing. So if I'm not trained well, I will not know how to put the power of the laser for my procedure. If I hire the parameters more than it should be, I will do carbonization. If I did a carbonization to the tissue, I will not get the benefit of wound healing. The wound healing will be delayed because of carbonization, and the patient will feel much more pain than the normal. So I didn't get the benefits of the laser I'm using. So you have to understand your laser device. You have to understand how to work with it, and it's very simple and it's very easy if you understand all of these things. Okay, gingival trophy, it is defined as the narrow space between the free margin of the gingival epithelium and adjacent enamel of the tooth. Permanent alteration of the gingival contours around a teeth is necessary to ensure a superior, long-lasting cosmetic restorations. Yes, we always face this kind of cases. A fractured tooth, for example, there is a cavity and there is overgrowth of gingiva inside the cavity. You cannot put your restoration directly because of blood. Or you want to take an impression for doing fixed orthodontics, so you cannot take the impression because of the gingiva, because of the blood. So you can benefit from the laser, all of this by doing hemostasis, or after gingivectomy, or after gingival trophy. There is no blood, so you can put your restoration directly after doing the cavity, or you can take the impression directly after the reduction process. So the functions you are controlling is a good access to the operation site and all the margins clearly. Blood-free environment can achieve hemostasis if necessary, ensure bacterial decontamination of the field, control the soft tissue contours for a harmonious, aesthetic, and functional relationship between the soft tissues of the periodontium and the restored hard tissue of the teeth and underlying bones. Okay, this is a case I've done. We may say it is a gingival recontouring more than it is a gingivectomy. You can see here the before picture, the patient suffering from a gummy smile, and immediately after is perfect, blood-free environment. You can do the decontamination after gingivectomy. The patient is smiling and she doesn't feel any pain. And after 1 week, full healed, there is no any inflammation, and it's perfect after 1 week. This is another case. You can see here I've done only the laterals, the upper laterals, to get the perfect and good smile. And also the immediately after, as you can see, there is no blood. The patient is smiling and she's not having any pain. And by the way, I didn't use any anesthesia injections. I only used topical anesthesia. Okay, this case I've done also gingival recontouring and bleaching too. This is the after healing picture, and also it's very good and properly healed. Okay, this is one of the most interesting and my favorite cases actually. I've done it here in mid-link using force medency device. You can see before she has a very massive gummy smile. The immediately after is perfect. She's smiling, she's happy, there is no blood, there is no pain, she was smiling, there is no carbonization, and the crowns are really amazing. They look perfect after the gingivectomy. And this is the after 10 days healing picture. Okay, here, this is a kid. As you can see, he's putting a space maintainer, and his premolar has having an overgrowth gingiva over it. And his orthodontist said he can't put the brackets of the braces on the premolar. So I've done for him exposure for the tooth while using diode laser, of course, and I did decontamination and hemostasis after the procedure. This is the immediately after, and for sure I didn't use any anesthesia, only topical anesthesia. You have to understand your patient, and you have to know how to put your parameters for not doing anything wrong while working, and also the pain threshold of the patient is very important. So here's after 1 week, it's perfect and completely healed. Okay, the phenectomy. The indications of phenectomy is like for gummy smile or diastema, whatever it is. If it is indicated, you are going to do a phenectomy perfectly with diode laser. But there are keys for successful laser phenectomy. You have to create a peri-osteofiltration at the base of the phenectomy to prevent the reattachment of the fibers. Also, removal of all ending muscle fibers to prevent recurrence of this phenectomy. Here you can see the before picture and the immediately after. This was a child, as I can remember, and the immediately after is a blood-free. And I did a photobiomodulation also after doing the surgery. He was feeling pain, so I did the photobiomodulation, and this is after 1 week picture. It's not completely healed, but it is almost healed. Here's the opportunity. Yeah, I forgot to tell you. In the phenectomy, you should inject a little amount of drops of injection, anesthesia injections, because this is one of the treatments the patient is going to feel pain, but only few drops, not a full injection of anesthesia. Okay, the operculectomy, it is a very easy case. As you can see, it is fibrotic a little bit, the tissue. So you have to higher your parameters a little bit without doing any carbonization. And also I didn't use here any injections, only topical anesthesia. And here is the after 1 week. Okay, the gingival depigmentation, it is the best and most reliable and satisfactory method for diode laser. As we know, it is full of pigments. So the diode laser loves pigments and can work perfectly with pigments and blood. Can you imagine if you are doing gingival depigmentation with the normal and conventional technique? If you are using burrs or you are using scalpel, for example, you are going to face main problem, which is severe bleeding, and also the patient will suffer from pain, and you should inject the patient many injections, anesthesia injections, so he cannot feel pain. But with diode laser, it's not that way at all. No, it is very fast procedure. You finish it in just a matter of 2 minutes or something. So the aim of gingival depigmentation while using diode laser is not to cut the tissue, but rather to deliver the laser energy deep to the epithelium to be absorbed by pigment. Here is this case. As you can see before, the patient is suffering from upper and lower pigments. Immediately after, no bleeding. I didn't use any anesthesia, only topical anesthesia. I want you to know something. Immediately after, you can see in the upper arch, there are still some melanin in the upper arch. Why I'm not removing these pigments? Because I don't want to reach the bone. If I reach the bone, the healing will be delayed. I don't want this. And after reepithelialization, all these pigments will disappear, as you can see, after 1 week. After 1 week, if you feel like you left some pigments due to the bone, you are going to reach the bone and you don't want to do this. So you will wait after 1 week and see the follow-up. If the follow-up is good, okay, he doesn't need any other sessions. So as you can see, after 1 week, it's perfect. There is no pigments at all, and the patient was very satisfied. Another case, before, immediately after, and after 1 week, it's perfect, no pigments at all, and complete healing. Okay, this patient was from Sudan, so due to his dark skin tone, he's suffering from a massive pigments in his lower arch, as you can see. And after 1 week, while using diode laser, it's perfect, completely healed. And it's only from 1 session, by the way, and no injection, anesthesia injections, only topical anesthesia. Okay, lesion removals and management. The most important thing is the right diagnosis. If you diagnose your case good, you are going to do the treatment perfectly. For example, the hemangioma is full of blood. If you are thinking how to do hemangioma conventionally with the conventional technique, you are going to face a much bleeding, and it's not so good for your patient. So if you are using diode laser for hemangioma removal, it's going to be perfect. As you can see, it's a benign tumor caused by abnormal growth of blood vessels. So the before the patient is suffering from a hemangioma in the tongue, and this is the immediately after. I didn't do any ablations, only a treatment. So it looks like a white scale, and you have to inform your patient that this white scale is going to be dropped off his tongue within days. And this is actually happened after 1 week. It's beautiful, completely healed, no more hemangioma. And by the way, this is one of the cases contraindication for photobiomodulation. You cannot do photobiomodulation after hemangioma removal because you don't want to regrow the cell growth and the blood to recurrent in this area. Okay, the fibroma is a benign tumor consisting mainly of fibrous tissue. The fibroma, it is a fibrous tissue, very white. So you have to put in mind while using diode laser in this case that you have to higher your parameters a little bit, but at the same time you have to think that you should not higher than the normal to prevent carbonization. It may take a little bit more time in healing. As you can see, this is the after 5 days picture, and the after 2 weeks picture. It's very good, and the patient was very satisfied. In this fibroma case, I injected a little bit, and the hemangioma too, anesthesia, but only few drops around the tumor or around the fibroma. Okay, there is post-operative instructions. You should tell your patient for the first week to not use hard toothbrush, only soft toothbrush. Soft food are more preferable, and an over rinse can be, may be considered. Okay, finally, with the laser bleaching, what is laser bleaching? What is bleaching actually? It is the process of using special materials to make teeth look whiter. The material remove stains or other discoloration from the tooth surface. Of course, by using bleaching gel in combination with laser, we are going to discuss this later in the slides. Okay, what is the advantages of using laser bleaching? The advantages, it's ultra fast, from 3 to 5 seconds to activate the bleaching agent, reduces the risk of rising pulpal temperature. It may act as a jump start to difficult cases by helping to remove difficult stains caused by tetracyclines and fluorosis. Can be used for selective bleaching, small size, portability using flexible optic fibers. The disadvantage of laser bleaching, maybe it's a little bit expensive. It rarely causes sensitivity. You have to ask your patient first before doing any treatment if he's having a sensitivity in his teeth or her teeth. If she's having a sensitivity, you have to tell her that you may feel a little bit sensitive after the bleaching because of the normality of your teeth structure. Okay, before doing any bleaching with diode laser, we have to make sure that your laser device is working perfect and the bleaching gel is good and not expired. You have 2 ways for using diode laser device in bleaching. The first way you can use is by multiple teeth technique. Each quadrant, as we can see here in the picture, and also I'm having here the bleaching handpiece, okay, from the companies. Okay, this handpiece, you can bleach every quadrant. Okay, yeah, I will show you in the pictures. You can bleach a couple of teeth at the same time, and also you can remove this handpiece, and you only can do bleaching for a single tooth if the patient is suffering from only discoloration in a canine, for example. So you can bleach only this canine, and this is a very good advantage and benefit from using a diode laser device in bleaching. Okay, let's see the steps. Step 1 is the preoperative picture for documentation. It's very important to document either the bleaching cases or your surgical cases. Any case you face in your dental clinic, you have to take a preoperative picture, a preoperative shade, scaling and polishing for sure before the bleaching. You can apply a Vaseline on the lips of the patient because you want of the cheek retractor. She may face some dryness in the lips, so you have to apply Vaseline. Of course, the cheek retractor application is very important for the oral hygiene. You don't want the bleaching gel to reach any of the lips of the patient, the oral cavity. So cheek retractor application and cotton rods are very important for the isolation. Gingival dam application on the gingiva, and the bleaching gel applications. You have to apply the bleaching gel on the whole tooth. Every tooth you have to make sure you are putting the gel all over the teeth. You are not leaving any part of the teeth uncovered. Of course, the laser safety is very important. Putting the laser goggles on you as an operator and on the patient for sure for safety. And if you are having an assistant, she should wear also the goggles. Okay, then you are going to select the whitening category from your laser device. And here at the picture, I'm going to use the multiple tooth technique using the handpiece of bleaching. You are going to activate the laser. Of course, it depends for the patient. If you found the patient has a good enamel and is indicated for every procedure has a limit of power. If you are going to lower your powers or you are going to higher your powers, it's upon the case. So you have to think and have to know what is the most suitable power for your case for the patient without hurting them or making them feel pain. I mean. You may repeat the sessions if you want in bleaching, by the way, and you may wait between the two sessions for like from 10 to 15 minutes between the sessions if the case needs this. After that, you're going to remove the gel. It's the final step, removing the gel by high suction, and you can use gauze for removing the gel. Gingival dam removal, post-operative shades, post-operative picture. So these are the steps of bleaching. Okay. Now you have to give your patient some restrictions to not to eat or drink anything for 2 hours after the bleaching session. Do not eat any staining food, only white or colorless food or staining drinks like coffee, sodas, and teas for 1 week. Use white polishing paste, and also you have to follow up with your patient after 1 week. This is my clinical cases. You can see here the after picture. If you can see in the middle of the two centers, there is still a little yellow color. But the good news after the follow-up, but I didn't take a picture, unfortunately, this yellow color disappeared. The white color took all the crown. And here is another case, very beautiful, and the patient felt so satisfied. By the way, this is the same patient I did for her the lateral recontouring. As you can see, her smile is different, it looks different. Okay, this case, I did for her the bleaching. As you can see in her lower arch, the lower teeth, it's cracked, okay? So I told her that you may feel some pain while you are having the session, the bleaching session, but the good news too that she didn't feel any pain, and I was really surprised, and she was very satisfied with the results. Okay, this case, I'm so sorry about the before picture. I took it from the patient. Actually, I forgot to take a pre-operative picture of her at my dental clinic. So I did this patient. I did for her also gingivectomy and bleaching, as you can see in the after photo. And by the way, I did both of them at the same visit. I did gingivectomy and then bleaching at the same visit, and she was very happy and satisfied. This is another case. This one too, I really love this case. There's a very big difference. This one too. And here you can see, I know that from the indications of indications of using bleaching in general, not only for diode laser. If the patient has restorations, you should change the restoration. So this patient had many restorations in her upper teeth, the centrals, laterals, and canines. By the way, I think the left canine, she's having a restoration. So I did scaling and polishing, a really good polishing, and I did her bleaching, and I told her that she should replace the old restorations, and she's coming in the next visit for restoring the old restorations. But as you can see in the after photo, it looks perfect, by the way. There is no whole big difference in the color due to the polishing I did. Okay, I think this is the last picture for the cases, bleaching cases. Thank you so much. I was really happy being with you today, and I hope you find my lecture and Dr. Am's lecture very useful for you. And I want to thank Arab Medical Company and Medici, of course, and MedLink for having me and Dr. Am today, and looking forward, inshallah, for the next presentations. Thank you so much.